Early Learning Division has partnered with the Oregon Health Authority to create guidelines to keep child care running safely for providers, children, and families. This video is to help parents understand how they can help providers comply with these guidelines and keep their children healthy and happy. For this reason, we will not be touching on all the requirements, as most are the responsibility of the provider. If you're interested in reviewing the health and safety guidelines, the document is available to the public on the Early Learning Division's website and is linked in this video. Please note that these guidelines are the requirements from the state, but your provider may have stricter or more specific rules as part of their individual COVID-19 plan, so please make sure you're communicating with them if you have any questions. The Early Learning Division and the Oregon Health Authority have identified 4 primary methods to reduce the spread of COVID-19 in childcare. These methods are the use of face coverings, physical distancing, restrictions on group size and creation of group stability, and cleaning and sanitation practices. So, how can you help? The use of face coverings. The guidelines require all adults and any children kindergarten age and up to wear a face covering. Children between the ages of 2 and 5 can wear a face covering at parents' request if the face covering fits the child's face measurements and they are able to wear it properly and remove it on their own. Children under 2 can never wear a face covering. As a parent, family member, or caregiver, you can help providers comply with this by wearing a face covering at drop-off and pickup, even if you're not going inside. Helping your child understand why they need to wear a face covering and how they can wear it properly. If you or your child cannot wear a face covering because of a medical condition, your provider will need a doctor's note stating that a face covering cannot be worn. Face coverings are not worn at mealtimes or rest times and may be left off during outside playtimes if a distance of 6 feet can be maintained. Check with your provider to see how face coverings are stored when not in use. Providers cannot force a child to wear a face covering, so please help out by encouraging your child to wear it and helping it be a positive experience. Physical distancing. Physical distancing is one of the most effective strategies for helping to reduce the spread of COVID-19. Yet, within the childcare and early education environment, it's not always feasible to maintain physical distancing as a primary strategy for helping to stop the spread of COVID-19. However, there are ways to reduce the amount of times that we are in close proximity and to reduce the amount of people we are in close proximity to. Your provider should have a specific plan for drop-off and pickup that include these guidelines. Please make sure you understand their plan and ask any questions you might have. As a parent, family member, or caregiver, you can help providers comply with this by using the designated outdoor space at drop-off and pickup. If you're using a home care provider, please follow the procedures put in place by your provider to make sure that only one family is inside the home at any time. Maintaining a 6-foot distance except during the physical handoff of children. This includes when speaking to providers or other families or children. Following your provider's procedures for meetings or conferences that would normally take place in person. Your provider may request that these meetings and discussions take place over the phone or virtually. Restrictions on group size and creation of group stability. Limiting the number of people that your child comes in contact with on a daily basis is a key way to limit the spread of COVID-19. The guidelines have specific rules about the sizes of stable groups that are allowed in childcare facilities. As a parent, family member, or caregiver, you can help providers comply with this by understanding that providers may not have as many part-time slots available in their program because they are limited in the total number of children that can be enrolled in a stable group. Understanding that providers may have strict rules on drop-off and pickup times or attendance schedules to help with group sizes, staffing, and allow for proper physical distancing. Limiting the amount of adults that participate at drop-off and pickup to help reduce exposure to more people. Help children understand new routines around their daily schedules as providers are making changes to limit exposure in shared spaces. Cleaning and sanitation practices. Cleaning and sanitation practices are always important for keeping children and adults safe and healthy in childcare programs, and they are even more important now. The new guidelines have very specific rules around when items and areas must be cleaned and sanitized. It also limits the items and areas that can be shared. This is a lot of work for providers. As a parent, family member, or caregiver, you can help providers comply with this by making sure your child washes or sanitizes their hands upon entry to the facility, following new sign-in and sign-up procedures designed to limit contact, not bringing unnecessary items from home, such as toys or books, making sure that children who need to wear face coverings have a clean covering daily, not letting your child play on outside play structures or in common areas outside the time designated by their provider, as these areas would need to be cleaned and sanitized again, helping your child know proper hand washing procedures, following your provider's policies around washing, changing, and storage of nap items and soiled clothing. If you're entering your provider's home, please wash or sanitize your hands and minimize the surfaces that you come in contact with. Other ways that you can help. Be prepared to answer the health screening questions every day at drop-off. Clearly communicate with your provider if you have questions or concerns about policies or anything happening in the program. Keep your child home in accordance with your provider's illness policy and exclusion requirements during COVID-19. Exclusion rules for staff and children. Providers must exclude children or staff that have fever, unusual cough, new loss of taste or smell, or shortness of breath in the last 10 days. If a child or staff member's only symptom is fever, and a medical professional advises that they can return to care, they may do so after they are fever-free for 24 hours without fever-reducing medication. If the child or staff member tests negative for COVID-19 during the 10-day period, they may return after they have been cough and fever-free for 24 hours without the use of cough or fever-reducing medicine. Documentation from a medical professional is required for a child or staff member to return to care after they are 24 hours fever-free without medication if their symptoms are similar to COVID-19 but diagnosed as something else. Adults or children who have been exposed to someone with a current or presumptive COVID-19 case must be quarantined for 10 days. Families will be communicated with in conjunction with the local public health authority if anyone in the facility has had a confirmed case of COVID-19. All staff and children in a stable group that have come in contact with a case of COVID-19 will need to be quarantined at home for 10 days. In issuing these guidelines, the Early Learning Division and the Oregon Health Authority are seeking to support the availability of essential childcare and early education services, while also protecting the health and well-being of staff, children, and families. You should be in communication with your provider to find out how the guidelines will be followed in your child's program. The complete guidelines can be found on the Early Learning Division's website, as well as other helpful information for parents about childcare. Providers and childcare staff are working hard to keep childcare healthy, safe, and fun. Thank you for doing your part and supporting them as much as you can, so they can continue to operate and provide safe and healthy environments to the children in care.